you, Dr. Nanavati. I want to thank my colleagues for the opportunity to address you all, as well as Dr. LaRoccarina and Dean Duggan. I'm going to start out with a confession, something that many of my fellow classmates and graduates may not know about me. I did not start medical school thinking that I would get a Master of Public Health degree. Luckily, my fellow dual degree classmate, Matt Cortez, and several other MPH students educated me regarding the value of this degree for my career aspirations. When I told my family and friends about this new path I was taking into the mystical land of public health, I was met with a few questions. The first was why on earth I would choose to further prolong my education and delay my employment for yet another year. It took a while for them to get over that one. The second question, which is something I'm sure almost all of my classmates have been asked, was along the lines of, what is public health and what does one do with this degree? Usually, I would mention something about preventive medicine, or sometimes I'd share the story of public health legend John Snow, the epidemiologist from London who found the source of a cholera outbreak in the 1800s. Sidebar, I was always very encouraged that people seemed to know who he was, only to find out that they were talking about a completely different John Snow. Looking back now, I realize how simple my explanation of public health was, and how at the time I had a very limited appreciation for how broad public health was as a discipline. Therefore, I'd like to share some things I've learned from my colleagues and my coursework throughout my years in the program. Perhaps the most important lesson I've taken away from my studies of public health is the unique role so many healthcare professionals play in our healthcare system. We often hear about how different medical professionals learn medicine independently but deliver healthcare in teams. For me, my public health coursework provided me with a unique opportunity to learn and dialogue with classmates from a variety of personal and educational backgrounds. I took classes with many different healthcare professionals, including athletic trainers, nurses, physician assistants, and physicians from a wide variety of specialties, as well as several people with non-healthcare related training. Some of us were fresh out of undergrad, while others were distinguished healthcare professionals. In fact, I came to know Dr. Nanavati as my biostats classmate, where we bonded over a shared adversary of SPSS. Together, with all of these unique perspectives, we discussed and sometimes debated heartily issues such as healthcare access, health-related policies, disparities in care, and cultural and behavioral determinants of health. Each of us brought a valuable perspective to the table. Looking forward, our healthcare-related passions are also very diverse. Our interests spanned age ranges, practice settings, and geographic locations. Some of us aspire to careers in research, public health policy, healthcare administration, and of course, clinical care. Many of the students I learned alongside have already graduated from the program and have gone on to pursue healthcare careers that I didn't even know existed when I began my course of study. Although the core classes we each took are identical, everyone seems to be finding their own niche. So what is public health? My answer today is much different than it was when I first began this journey. What I say now is that public health is the glue that holds our healthcare system together. And I'm not only referring to us on the stage with the pink, or as some say, salmon hoods, because I don't think someone needs a degree in public health to appreciate the relevant concepts. A mindset geared towards system-based problem solving, population health outcomes, and evidence-based interventions can be universal regardless of what degree one holds. As one of our favorite professors says, I also submit to you that public health is the future. As our healthcare system evolves, issues such as access, prevention, and the use of data to inform decision-making are more crucial than ever. We as public health professionals are fluent in this language, giving us both the ability and the responsibility to be a part of these discussions, no matter what corner of the public health world we find ourselves in. So I thank you, both my MD and MPH classmates on this stage, for learning beside me, but also teaching me, inspiring me, and challenging me. I can't wait to see what we accomplish in the years to come, both individually, but more importantly, collectively as healthcare professionals. Thank you.